Hi guys, Willie from Philly back with a subscriber request for the contents of my IFAK from either tear-free or tear-free 1600. So I figured I would do that, and the BooBoo kit says they're used in conjunction with one another. I also want to say thank you. My first video has 500 views and I gained 13 subscribers. I was never expecting anything like that. So thank you guys very, very much. So guys, I keep my cat tourniquet on the outside pocket of my bag. The reason I do this is you want to have quick access to that. I know from personal experience, during an emergent situation, panic sets in. You don't want to have to be searching through your bag to find your tourniquet. So, because a person can bleed out very, very quickly. So always have that handy. Also, if you do not know how to use any of this equipment, please do not. You will do more harm than good. I also encourage everyone to take first aid and CPR training through your Red Cross, through your local fire department. Get trained, watch videos. Also, know the Good Samaritan laws in your state. I can't advocate this enough, guys. Okay, so everything on the shamag is in the IFAK, and everything behind it is in the BooBoo kit, but we're going to go over both of them together. So here we go. In the IFAK, I have 2 tegaderms, which are occlusive dressings that can be used over bleeding to secure another dressing, smaller dressing. If you put some numbing cream on, put that on, let it sit for a while. Just small occlusive needs. Next is a super skin package from My Medic's. Got all different sizes of band-aids and some antiseptic cream. It's pretty neat. I have 2 sides of nasopharyngeal airways with lube. Please do not put these in without any lubricant. You can cause damage, and it's painful if the patient is somewhat conscious. So I have a child size and I have an adult size there. I have a compressed gauze from Refuge Medical, I do believe. You can use this as packing by itself or as an occlusive dressing. Coban, which is an occlusive dressing. I have a staple gun. Okay, I also have sutures. And yes, I know how to suture, and I have both the straight and curved hemostats right there. I have just some regular tweezers, my trauma shears. I have a number 10 scalpel blade and my scalpel blades up there to differentiate the 2 kits. I'll send you that when I get there. I just have some regular gloves. I have some glucose gel for your diabetic patients. Sugar, low sugar is a very common thing, and this can be done right under their tongue. They don't have to be conscious, and it can help in a situation. This is another pressure dressing with the dressing built in, so it has an ABD pad inside the wrap. Okay, just some 2x2s here. I got some 5x9s over there. I have some non-adherent 3x3s. I also have some 2x2s. Guys, if you're a Dollar Tree shopper like I am, you can get a lot of these ointments and creams and meds at the Dollar Tree, but what they have that I find is the best is they have a blue kit, and the kit contains 4x4s, 3x3s, 2x2s, 3x2s, 2 rolls of gauze, and a roll of tape for $1.25. I think you get 20 pieces. If you see them, snatch them up. I always do. They're a great find. Okay, I have a roll of tape. I have a lighter, some KT tape for some ankles, to tape some ankles, steri strips for your smaller cuts that you don't want to suture. I have some tongue depressors. Check somebody's tonsils to see if they're swollen. Never, ever put your fingers in someone's mouth if you think you see something that they've choked on. That will cause more harm than good. Please, guys. I have some quick clot. Okay. I know people get bleed stop, and in a pinch, it's better than nothing, but that is granular, and it's very hard to get out of a wound once it goes into the wound, because eventually everything that goes in has to come out. So I understand if it's a last ditch effort, yes, but please use your quick clot gauzes. The gauzes are a lot easier and cleaner to get out of a wound. Okay, when they finally do reach medical help. I have a triangular bandage, some oral rehydration salts, okay, Silvex cream, which is a silver based ointment. It helps with to fight off to fight off infection at the skin level. I also have two different sizes of gauze. My previously mentioned cat tourniquet. I also have a rat tourniquet or a rapid action tourniquet. This I use for kids and for animals. You can use it for. The application of this is a lot different than a cat tourniquet, so please, again, do your research, learn how to apply it before you start using it. Then I have my splint. You can use the shamag, which is everything sitting on, to help hold that and tear the shamag into strips and wrap it around. You can also use the shamag as packing in a last-ditch effort. You can use it as a makeshift sling. So the shamag has lots of uses, and that's why I carry it in conjunction with my kit. Okay, so some of the meds that I keep in my trauma bag. I have some Benadryl. I have some tummy medicines. I have some Medilite, which is oral rehydration. I have some that is for allergies. I have some diphenhydramine, some Excedrin knockoff medicine there. Okay, some acetaminophen, aspirin, which is great for if you suspect somebody's having a heart attack. You also always want to check allergies before you give anybody anything. Diamod, some ibuprofen. And then, so now moving on to this section. This is all what's in my BooBoo kit. I have some special wound products from when I worked at the hospital. So those two help with wound healing and wound care. The Camos butter is for chafing. Okay, I have some white petroleum jelly. You can use that for your lips. You can use that on cotton swabs to help for fire starters. Some lip balm, an antiseptic wipe, some Proven iodine sticks to prep an area, alcohol pads, sting relief pads, BioFreeze, oral pain med, hydrocortisone cream, some more aspirin, diphenhydramine or Benadryl and ibuprofen, a BZK antiseptic wipe, iodine pad right there, some antibiotic ointment, triple antibiotic ointment, insect protection cream, vitamin C, burn gels, sunscreen, stuff up there for blister prevention, ear pro, a multitude of Band-Aids. I have some dental floss, some more gloves, two things of liquid skin, that's super glue, and then some compressed towels where you put a drop of water on them and they turn into like a handheld napkin, which are great for helping to clean things up. Okay, guys, so that's the down and dirty quick version of my IFAK and my BooBoo kit. Once again, thanks for the views on the last one, and I hope everybody has a safe and joyous holiday season.